Hi everyone, welcome to our weekly show, The Subcontinent. We are here to bring light to some of the most important issues affecting the region. Along with an in-depth analysis of the topics and perspectives from regional and international experts, we shall review what key players think and what the common people have to say.
In this edition of The Subcontinent, we will be reviewing the healthcare system of India amid the coronavirus threat to see whether the so-called largest democracy of the world is ready for this pandemic. And we shall look into how false rumors on social media sparked deadly tensions against the Muslims of Sri Lanka.
Despite being one of the largest economies of the world, India has maintained a bad record of healthcare access and quality. In fact, the situation is so poor that more people die due to poor quality healthcare rather than its access. In the report published in the Lancet journal, researchers have found out that almost 122 Indians out of 100,000 die each year due to poor quality of care, and this ratio is higher than the same report findings in India's own neighboring countries such as China, Pakistan, Bangladesh, Sri Lanka and Nepal. This healthcare problem runs parallel with an extremely impoverished sanitation system, as millions of people still practice open defecation, and hundreds of children under the age of 5 die each day from diarrhea.
As the world is struggling with the containment of COVID-19, it is a mystery how the world's second most populous nation, with 1.3 billion people, has remained relatively unscathed, while the number of cases explodes to its east and west. India shares a lot of the same regional disparities of healthcare access quality indexes with China, as well as comparable economic growth. There are glaring differences in healthcare outcomes within the country. Healthcare being a state subject, the healthcare outcomes have remained divergent based on the quality of the state administration. While North India is the most populated part of the country, it has one of the most undeserved healthcare infrastructures. Consequently, for example, while hundreds of children died in hospitals in Uttar Pradesh last year, Kerala managed to contain the deadly Nipah virus outbreak within weeks. 71% of the population live in rural areas. There are limited doctors and hospital beds per 1,000 people. Hospitals and healthcare facilities are predominantly located in urban areas, making them difficult to access by rural populations. The poor health infrastructure that is already overburdened and overstretched in India might not be able to handle another epidemic where hospitals become a node for further infection. In other parts of the country where medical infrastructure is poor, it becomes nearly impossible to prevent outbreaks from becoming epidemics. Public health hospital specialists say that the uneven development of health infrastructure is a serious problem in dealing with epidemics, especially in packed urban areas with poor sanitation and where so many people live face to face.
Coronavirus pandemic has hit the world hard, and there is a debate over whether this would hit countries like India even harder. Even though India went into a lockdown to contain the virus, experts worry whether the already exhausted healthcare system of India can successfully deal with the threat posed by the virus. There are also concerns that the actual number of coronavirus cases might be drastically higher than reported, seeing that the country has one of the lowest coronavirus testing rates in the world, and lockdown was only imposed nearly 2 months after the first case was reported in India on 29th of January.
Despite a creaky and uneven public healthcare system, India has a formidable record in defeating polio and facing up to a swine flu pandemic in 2009, and handling a more recent outbreak of the deadly Nipah virus. India offers certain advantages in fighting the coronavirus outbreak. Its flu surveillance program involves a cluster of medical colleges for screening. Virologists can now test samples by using the influenza program to find out whether COVID-19 is circulating in the community with quick diagnostics. Also, India is one of the world's largest producers of the generic drugs. India has indeed managed to escape the worst of the COVID-19 pandemic so far, possibly because of quick and strict efforts right from the start. It was one of the first countries to close its border, cancelling visas and denying entry to all except for a select few foreigners, as the first reported cases were travellers carrying the infection.
The challenge that we will face and the unpredictability is we are not able to estimate the mutation. As of now, we feel that the country will be able to tackle it. The country is taking, India is taking definite actions of sort of closing the borders, which probably is one of the wisest things to do now.
A 21-day complete countrywide quarantine was instated after state authorities began shutting schools, swimming pools, gyms, athletic arenas, malls and movie theatres. Fast cross-communication between public and private healthcare providers, health ministers and public officials responsible for initiating the government's robust surveillance network in districts in case of an emergency epidemic and the key role of the National Institute for Virology were one of the reasons Nipah virus was quickly controlled. Measures that India previously took to prevent other outbreaks may have helped prevent the COVID-19 outbreak from reaching an epidemic on the same scale as that which the rest of the world is currently struggling with.
We are now joined by Dr. Yogesh Jain, who is a public health physician and a founding member of Jan Swayasta Sahyog, or People's Health Group, which is a voluntary non-profit organization founded by a group of health professionals in India with the aim of reducing healthcare inequality. Welcome to the show, Dr. Jain. This coronavirus outbreak is a test for all countries around the world, and India is no exception. So far, how much do you think India's healthcare system has been successful in the test?
Well, the Indian government had little more time than many other countries to be able to manage this pandemic. And the Indian government did pick up by announcing some social distancing measures, including a massive lockdown. But in many other things, decision-making has been not the best, not even so swift. But I think they're learning while they're doing. And overall, I expect that over time, they would have managed the outbreak as well as it can, given the state of our public health system that it always has been in the last so many years. We have had a rather broken system in health, and in this situation to be able to do well is the maximum that we could have, that we can expect, that it would be just okay.
Thank you, Dr. Jain. Regional and international media have also shown concern for India's healthcare system. Let's see how they are following the developments.
For local Indians, the cost of private healthcare is about 4 times greater than the country's public healthcare. About 72% of residents of rural areas and 79% of residents of urban areas use private healthcare services. More than 63 million Indians are faced with impoverishment every year because of catastrophic healthcare costs. Government launched the Ayushman Bharat Healthy India program as a response to the inequities created by an underfunded and severely overloaded public healthcare system. In India, there is one government doctor for every 10,189 people. The World Health Organization recommends a ratio of 1 to 1,000, or a deficit of 600,000 doctors.
All right, welcome back, doctor. I have another question from you, and I know that since you're running an NGO, you might know this better. Do you think it is true that most Indians choose medical care from private sector even though it is more expensive than the public sector?
Yes, I think the problem there is that the fact that Indians predominantly choose private sector for their care, especially outpatient care, has been used wrongly as the cause being that they like to do it. It is because they have no choice. We have a poor, often dysfunctional public health system, which forces people out of no choice of theirs to go towards the only available second option, which is not also a great option of the private health system, which suffers from all these problems of being high in cost, not so good in quality also, and the quality has not been shown to be any better than that of the public health system, but it may be a little more convenient when people can access it at times that are appropriate for them, but not for the public health system. So I would say, in this case, we have to ensure that a strengthened public health system is the one that manages the problems of great crises like this COVID crisis, as well as see that as a way to improve the public health system for managing post-COVID epidemic problems that we have in plenty in this country.
Thank you, Dr. Jain. It was wonderful having you here, and we'll see you next time. People have shown mixed reactions regarding the healthcare problems in India. Let's see how they see the situation. Facebook has replaced the traditional media as a source of news for people in Sri Lanka, which means that now anyone can spread misinformation to deliberately harm anyone. Repeat a lie often and it becomes the truth. This can be demonstrated by what goes on in Sri Lanka's cyberspace, where a series of false allegations targeted against Muslims often fuel racial tensions and waves of violence against the minority group. This is scary because Sri Lankan officials and politicians are also accused of sometimes endorsing, ignoring, or even exploiting hate speech and mob violence directed towards Muslims by powerful Buddhist nationalists.
In 2018, a series of damning posts on Facebook stoked long-standing ethnic tensions in Sri Lanka, setting off a wave of violence largely directed at the Muslim minority. How are false rumors on social media fueling real-world attacks? Sri Lanka suffered a brutal civil war for over 25 years. Post-war Sri Lanka remains a divided country beneath the veneer of economic prosperity, relative calm, increased tourism, and large-scale multi-sectoral infrastructure development. The roots of democratic deficit lie in the lack of trust around poor public perception of key democratic institutions. The inherent messiness of democracy, coupled with the legacy of severe institutional decay, has today resulted in unmet public expectations. Since the end of the war in 2009, the government has done little or nothing to address what gave rise to the violent conflict. Today, violent content on social media is often the digital manifestation of longer-standing communal fears, anxieties, and concerns. These socio-political tensions have now metastasized into short-form videos, memes, and tweets produced by and for a young demographic. In spring 2018, rumors were posted on Facebook about schemes that Tamil-speaking Muslims were plotting violence against Sinhalese-speaking Buddhists. One such plot circulating on Facebook was that Sri Lankan Muslim groups were placing sterilization pills in food, a scheme which was completely fabricated and untrue. Resulting from such rumors, a restaurant was completely trashed by angry Sinhalese-speaking Buddhist mobs, and the livelihood of the Tamil-speaking Muslim owner destroyed, and the owner went into hiding for fear of his life. The situation further escalated in 2019, with bombings and greater violence, with tensions still continuing today.
The situation grew worse after 8 Easter bombings in April 2019 killed more than 250 people in 3 different cities. Even though Daesh claimed responsibility, Muslim minority of Sri Lanka was made to pay the price. After the attacks, violence and hate increased against Muslims. Reports of common acts include economic boycotts, vigilante attacks on women wearing hijabs, media smear campaigns, and destruction of Muslim mosques and homes. But this is far from over, as social media platforms such as Facebook continue to act as propaganda platforms for deliberate incitement of violence and hate against Muslims in Sri Lanka through fake news and misinformation.
Government leaders did not use social media to attempt to quell violence. Almost entirely missing on social media during the violence in March 2018 was content from senior government leaders aimed at quelling the violence. At the height of violence, there was nothing close to addressing the fallout or appealing for law and order, holding those responsible for violence accountable, detailing what police were doing to bring the violence under control, or providing political leadership. In 2019, the situation led to a government-imposed nationwide block of social media, and a curfew was instated. Facebook only got involved after it was blocked in the country. An uneven, unequal access to resources and other grievances around economics, especially in commerce and industry, leads to resentments and other emotions. Eventually, through visible, easily accessible, frictionless paths provided by nefarious actors on social media, the unanswered grievances and emotions find expression in a mob mentality and overt racism. The result is that racism grows and is seen as a root cause, when in fact its genesis and growth is enmeshed in more complex socio-economic realities in specific geographies which predate social media. As Facebook pushes into developing countries, it tends to be initially received as a force for good. In Sri Lanka, it keeps families in touch even as many work abroad. It provides more unprecedented open expression and access to information. Government officials say it was essential for the democratic transition that swept them into office in 2015. But where institutions are weak or undeveloped, Facebook's newsfeed can inadvertently amplify dangerous tendencies. Content produced in Sinhala on Twitter does not have the reach or influence of content on Facebook. Social media blends news, gossip, and entertainment. Those on social media don't or cannot always discern and critically differentiate between gossip sites and more credible mainstream media sites.
To discuss the situation on Sri Lanka, we are now joined by Dr. R. Charan, who is a poet, a journalist, and also an academic with the Department of Sociology and Anthropology at the University of Windsor in Canada. Dr. Charan, welcome to the program. Why do you think the government in Sri Lanka has not been able to effectively respond to the violence and attacks instigated by ethno-religious tensions?
I think we need to understand the nature of the Sri Lankan state. I am talking about the Sri Lankan state. The governments can come and go, but in Sri Lanka, the state as an institution that stays. And that state in Sri Lanka is a mono-ethnic state that has been built over the time to cater and support and guarantee the rights of the majority Sinhalese Buddhist people. So the idea of discriminating or marginalizing the minorities is an inbuilt character of the Sri Lankan state. And if the minorities decide to contest, resist, and start fighting, they will be severely oppressed, and the Sri Lankan state will not be reluctant to use even genocide. If we understand that situation, then it is very easy to understand why the Sri Lankan government is not doing anything with regard to the rights of the others.
Thank you, Dr. Charan. Before moving on to other questions, I would like you to see the trend that the global media has been following in terms of what is going on in Sri Lanka. Let's look at the media.
The largest ethnic group in Sinhalese, estimated at 74% of the population, followed by Sri Lankan Tamils 12% and Muslims 7%. A ProPublica investigation found that Facebook's rules are opaque to users and inconsistently applied by its thousands of contractors charged with content moderation. The Sri Lankan government harshly criticized Facebook for its failure to properly police hate speech in local languages. Rumours of a Muslim plot to sterilize Sri Lanka's Sinhalese majority led to a real-life violence in February that resulted in the beating of a Muslim restaurant worker.
Thank you for staying with us, Dr. Charan. So on that note, do you think that digital literacy is important in understanding the content on social media?
Social media is a is a very different creature. So we cannot simply use the previous legislations and understanding and the law, etc., to either to monitor or the control or to deal with the social media. On the one hand, it's been extremely positive in certain sense, but it can also have extremely negative consequences because social media has created thousands and thousands of, I would say even millions of journalists and photojournalists. Everyone who has access to a smartphone with a good camera could become a photojournalist. Everyone who can write or comment on, they think they can become a journalist, and that has been the case.
What is your opinion about freedom of speech in social media, and when and by whom should the content be regulated?
It's a large universal question that we need to answer. And first of all, I do not think we should grant the right and permission for any state institution to monitor or control. And the second thing, I would fully support the freedom of expression and freedom of the press under any circumstances on one condition, that the freedom of expression and free speech and freedom of the press should always accompany the responsibility on the part of the media and the media institution. And second, freedom of expression and press freedom has a limit. In the name of free speech, we cannot simply go and say that kill all the Tamils or kill all the Arabs, advocating hate, advocating massacre. But ironically, these are some of the issues in the name of freedom of speech in the United States, in Europe, and also in Sri Lanka, that all these hate mongers and the propagandists of hate speech are using it.
Thank you, Mr. Charan. Some interesting views with regards to what's happening in Sri Lanka. Some people on social media platforms are also concerned for the increasing violence and hate against Muslims. Let's see how people online see the situation. With this, we sign off this episode. You can follow us on our social media platforms to stay updated, and we will meet the same time, same day next week. Thanks for watching.